exploring the role of oral health and systemic health. And, I was talking a little bit earlier with you, Dr. Bauman, about just how interly connected the two are. And the benefits of that, we're going to talk a little bit about, risk factors and how it can affect systemic health. But, what I also like to point out is that by implementing therapeutic strategies with our oral health, we can drastically help to reduce our risk for a lot of handful chronic diseases. So that's where I think, for me, it's really exciting. So let's dive in. First, our little disclaimer here. And everyone can see my slides okay?
Yes.
Okay, great. All right, so our learning objectives for today are we are going to review the latest research and learn why oral health plays a significant role in systemic health. We'll discuss the implications of oral microbiome in oral health and systemic health. And we're going to learn about oral hygiene practices and botanical therapeutics that support a balanced oral microbiome. All right, so a lot about the oral microbiome today. So a little bit about myself. As Dr. Bauman mentioned, I am a naturopathic doctor. I graduated from Southwest College of Naturopathic Medicine, which is in Arizona, in 2014. And when I first came out of practice, I joined a Lyme literate clinic for the first 3.5, 4 years of my practice. That's really what I was focused on. And through my experience with working with Lyme patients, I really learned about treating every single system of the body. Unfortunately, there's a lot going on with these patients, so you really do have to learn about all the nuances and how everything is connected. I then started my own practice in 2018 in La Jolla, California, called Wildcraft Medicine. I have a focus on digestive health, hormones, fertility and preconception, and I do still see some chronic illness. And I've been working for Biocide and Botanicals as a clinical consultant actually since 2015, but officially since 2018, and also use their products very successfully throughout my practicing, about almost 10 years now in my private practice. So again, excited to share this information with you and also talk to you a little bit about how these products can support the oral microbiome. So let's start from the beginning for a second and talk about some of the history. So beginning in the 1950s, and honestly, even before this, we had very, very forward-thinking doctors that started to recognize the association between oral and systemic health. And I would say even before this, we had, the different practitioners really understanding, how what we eat makes an impact on our oral health and then also our systemic health. So the relationship itself is not new, but recently we've become to understand how intricately connected and linked the two are. For example, the discovery of oral bacteria has been seen in arterial plaques like coronary arteries and the carotid, and even in cerebral plaques, such as amyloid plaques, seen in a lot of degenerative brain issues. So, it makes it very clear that the oral microbes do not stay confined in the mouth. And so what happens when bacteria in the mouth are pathogens or harmful bacteria? This can lead to inflammation not only in the mouth, which can lead to things like bleeding gums and caries, but ultimately it can lead to chronic inflammation throughout the body. So to achieve total body health, we must include oral health as a key component. So I hope this is just a reminder, this talk, about when we're talking about our own health or talking to clients or patients about health, that we really key into what's going on in their oral cavities. Okay, so first we have to talk a little bit about the microbiome, right? And I think this is a pretty common topic these days in health, but the microbiota is very vast. In fact, most of it, 95% of it, resides in the gut, in the GI tract. And we often talk about the microbiome in relationship to the gut. Every person has a unique microbiota, which is kind of the composition of bacteria, fungi, viruses, even parasites that serve as a unique fingerprint. And kind of keeping this balance, the abundance, and the diversity is really ultimately what helps to determine gut health and overall health. Now, due to their small size, these organisms really only make up about 1 to 3% of our body mass, but this really misrepresents the microbiome's tremendous power and potential. So I think this is a great picture. It really shows just how many of them there are compared to us, right? We really are the microbiota that make us up. So we have about 100 trillion cells of microbes that live inside us. And we can see as this kind of major area here is the microbial cells, where human cells are only 30 trillion. Huge difference. And then when you compare the genes, how many microbial genes there are compared to human genes, you can see way down here in the toes, that's the human genes, where the rest of them are microbial genes. So, what's living inside of us really makes up who we are. So as a reminder, the microbiome can benefit the host in many ways. It supports with things like hydration, nutrient synthesis. They help to break down food so that we can absorb nutrients better. They help to control epithelial cell proliferation, which is a big piece to supporting the barrier lining throughout our bodies, but especially here talking about the gut. It protects against pathogens by that barrier effect, preventing them from coming through into the gut. It educates our immune system and helps to support that immune priming. It also can act as immune reserves for systemic defense, so for defending things, if we get exposed to anything that shouldn't be there. And they also help to produce things such as short chain fatty acids that are incredibly important for things like brain health, hormone metabolism, gut health, and so forth. So now let's shift for a second and talk about the oral microbiome. So there's 50 to 100 billion bacteria.
Years of my access to cheap quality probiotics.
So please mute yourself, so that we don't interfere with Emily's program. Thanks, guys.
No worries. And we'll have time for questions at the end too.
Yeah.
So this is just a great slide because it really just gives you that idea just how many microbes and bacteria in particular are in the oral cavity. So we've got 50 to 100 billion bacteria in the oral microbiome alone. And of those 50 to 100 billion, there are over 700 different species of bacteria in the mouth. And again, another description just to kind of give you a visual is there in 1 milliliter of saliva, there are 10 to the 8 microorganisms, quite a large number. And we swallow 1 liter or more of saliva each day. So what does that mean? What am I trying to describe here? That again, what's in the oral cavity has very easy access to the rest of our body, especially with swallowing all those bacteria each day. And then within the mouth, there's different niches that have different types of microbes depending upon where they're located. So the teeth have their own diversity and abundance of different microbes, the gums, the tongue, the tonsils, palate, and mucosa. And there are multiple different microbial types, even though we're talking about bacteria here, besides bacteria, which can be commensal, they can be, which means they're beneficial, symbiotic, living together, or pathogenic, which means they're harmful. We can also have fungi or yeast and viruses in the mouth. The other thing to note is that biofilm are involved quite heavily when it comes to the oral cavity, and we're going to talk a little bit about biofilm in a second here. So what are some signs of a healthy oral microbiome? This may be obvious to a lot of us, at least when we're looking at a picture like this. You can clearly tell this person has very nice teeth, but there may be some things on this list that can kind of trigger some new thoughts. So pink firm gums, the appropriate number of teeth for your age, no bleeding when brushing, flossing, or during professional cleanings. I think that one's a tough one. Even myself, I definitely get a lot of bleeding. But supporting gum health can really help to lower that bleeding. No visible plaque, which we'll talk a little bit later, is actually biofilm. No cavities or restorations due to cavities. Well lubricated oral tissue, that one's very important. Having a clean tongue, so no coating on the tongue, and then pleasant breath. All of these can be signs of a healthy oral microbiome. So on the flip side, signs of oral dysbiosis, we may see red, puffy, smooth gums. You may see visible plaque or calculus, coating on the tongue that may be white, yellow, and so forth. Some people may have bad breath, which is leading from a dysbiosis or overgrowth of certain microbes, either in the gut or the oral cavity. You may have visible caries or fillings or crowns present. There may be early loss of baby teeth due to decay, missing adult teeth, and dry mouth. So factors that influence oral health. So diet is by far one of the biggest influences on the oral microbiome, which probably doesn't come to a big surprise to many of you. So especially diets high in refined carbohydrates and sugars, those that are low in fiber, can encourage both gut and oral dysbiosis, that imbalance in microbes. So instead we want to focus, and we'll talk a little bit more in detail about this, but we want to focus on a lower refined carbohydrate diet, healthy fats, healthy, clean protein, getting lots of beneficial fiber, all important. Other considerations would be things like harder foods, things where we have to chew. This can really help support the actual alveolar, the teeth and the bone structure, and helping to the teeth become stronger and harder, as well as foods higher in fat-soluble vitamins like A, E, D, and K. This can help support as well the alveolar bone growth and enamel mineralization. Next, we have proper oral hygiene. This is, again, another probably not so surprising factor, but this is essential because the mechanical disruption of periodontal biofilm is really key to help keep the dysbiosis under control. Now, I will say you do have to be cautious sometimes. There are some things on the market, over-the-counter hygiene products that can have detrimental effects on the oral microbiome. It can upset the delicate balance with some of the harsh chemicals. So we're going to talk a little bit about making sure that we're choosing products that are going to support getting rid of the biofilm, but also not completely wipe out the beneficial flora as well. And then low salivary flow. This could be coming from using certain medications. Could be from people who are mouth breathers, people that maybe have sleep apnea, causing dry mouth. And this can definitely contribute to oral dysbiosis. And this one's a really important one because saliva contains protective immunoglobulins like IgA, IgG, IgM, as well as things like lactoperoxidase and lactoferrin that help to go after infections if they're there. It also contains pH balance in the mouth, the saliva does. It helps to feed those oral microbes and generally prevents cavities and periodontal disease. So having a dry mouth and lack of saliva can really be detrimental to that balance in the oral microbiome. And then lastly here, at least for this slide, the oral microbiome can be influenced by those with whom oral bacteria is shared. So who you're kissing, who you're sharing food with and drinks with. I really think this is an interesting factor because, we think about even our loved ones. I have a 14-month-old and he's starting to do the kisses with the open mouth kisses. And so I think about now how my oral health can really impact him. And so that just was a really cool kind of turned on the light for me. I mean, obviously, sharing food and kissing, but, little ones that you're exposed to and how we can help to benefit, support their microbiome in their mouth, especially little ones that are just starting to form these beneficial microbiome communities. Okay. And then lastly, there actually is another one I'm not going to talk too much about, but I think it's really interesting is genetics. There's a whole component with certain people having genetic predisposition to build up in biofilm and plaque and more susceptibility to cavities or caries. And this can be for a few different reasons. There's some genes that can affect how strong our teeth are, the mineralization. So those who can't keep up on supporting that hardness of the teeth and mineralization, they may be more susceptible to getting cavities. Other people have genes related to acidity. They have a hard time addressing high acidic environments, which is where certain harmful bacteria thrive. And so genetics can play a big role too. And if you know this about your family history, then it can really help you understand that you may need to pay a little bit more attention to some of these other factors to support your oral health. Okay, so here's an example of some of those over-the-counter hygiene products that may not be doing you as good as you think. So mouthwash, especially those that have chlorhexidine, have been significantly shown to increase the abundance of Firmicutes and proteobacteria and reduce the content of Bacteroides, TM7, SR1, and Fusobacteria. So what does that mean? This shift was associated with a significant decrease in salivary pH and buffering capacity, and accompanied by an increase in saliva lactate and glucose levels. That's sugar, right? That's driving this dysbiosis. So lower saliva and plasma nitrate concentration were found after using this chlorhexidine, followed by a trend of increased systolic blood pressure. So this point is talking about how there are many beneficial bacteria in our mouth that actually help to support nitric oxide production. Nitric oxide helps to dilate our vessels, which can really influence our blood pressure. So there's a huge connection now between some of these harsh chemicals wiping out the beneficial flora that can lead to either high blood pressure or a worsening of our blood pressure. All right, so mouthwash can kill both good and bad bacteria in your mouth. Yes, it makes your breath feel good, but what is the cost of that? So making sure that you're choosing products that don't wipe out all these beneficial flora is really important. This chlorhexidine is associated with that major shift in salivary microbiome, leading to more acidic conditions, lower nitrate availability in healthy individuals. So how does oral dysbiosis develop? It can happen a handful of different ways. Maybe it's poor oral hygiene from not brushing, flossing, getting regular cleanings. Those who are smokers have higher risks for oral dysbiosis through their inflammation pathways and the smoke affecting the microbiome balance. Those eating the high carb, high sugar diets, which we mentioned before, genetic SNPs, which means those predispositions to variations in genes that prevent us from having hard mineralization of our teeth or issues with acidic environments. Those that lack saliva or have a change in their salivary pH, medications that can affect the oral microbiome, systemic disease. In fact, there's a bi-directional effect, and we'll go into much more detail in this talk about that. Age, as we age, the oral microbiome changes. And we'll talk a little bit about the presence of Porphyromonas gingivalis, a bit of a mouthful. This is a very researched bacteria that has been shown to drive a lot of systemic diseases, especially through its release of something called LPS, lipopolysaccharides, that drive inflammation. Impacts of oral health. Okay, so this is another interesting thing to know, is that periodontal disease, which includes gingivitis and periodontitis, so inflammation of the gums and inflammation of the teeth, are the most common inflammatory diseases globally. Very interesting. It affects 50% of adults over 30 and 70% of those over 65. And again, this is an easy area to make a big impact without adding to supplement burden. So I love that we can really help, again, to support our own health and the health of our patients by making these small tweaks in our oral health can have huge impacts in the rest of our health. Okay, so some risk factors for gingival and periodontal conditions. Again, these are kind of similar to what we've talked about. The few that I'll talk about that are not here, that we haven't already talked about, are the pregnant women and the immunosuppressed. So interestingly enough, when women are pregnant, they have something called leaky gums, and this happens in all women. In fact, your insurance will typically cover more regular visits to the dentist when you are pregnant because they know that there is a higher risk for pregnant women to have periodontal issues. The reason being, the beautiful wisdom of our bodies, is that certain times in pregnancy, when there's leaky gums, the oral microbiome can go to the fetus and help to populate their initial microbiome. This is one of the ways that we start to feed and support the fetus. And at a certain time, then the leaky gums heal up and we don't have it anymore. But it's a short period of time when those microbes are actually supporting the microbiome of the growing baby. But this does leave women more susceptible during this time. The other ones are immune suppressed individuals. They may have a weakened immune system, they do have a weakened immune system that can lead to a dysbiosis in their gut microbiome as well as their oral microbiome and lead them to be at more risk for inflammation in the oral cavity. All right, so I mentioned before we're going to talk about biofilm. So plaque, which I'm sure most of us have heard about growing on the teeth, is just another word for biofilm. That's what biofilm are in the mouth. Now, biofilm, they're sticky extracellular polymeric substance. We are looking here at biofilm that's growing on toothbrush bristles, but they do grow quite easily on the gums and the teeth. And what happens with biofilm is communities of bacteria congregate together to form this sticky substance that they hide behind. In fact, biofilm are so strong and good at resisting our immune systems and oftentimes antibiotics, but you need 5,000 times the antibiotic concentration that's normally needed to eradicate the infection once biofilm are present. We always see biofilm present in chronic infections, and they're forming quite quickly. So in acute infections, we'll see them being formed in as little as 2 weeks from the onset of infection. But specifically in the oral cavity, biofilm are being formed all the time. And one of the major reasons, and we'll kind of talk a little bit about this, is that the teeth and the gums provide a non-shedding surface where this biofilm can easily manufacture itself and hold on. So they start forming even immediately after cleanings. They can progress and persist and become complex biofilm. So one thing to note here is that biofilm itself is not bad, but there's lots of different biofilm that are in the mouth. What happens is once they become a little bit more complex, if we start to see the microbes shift and become dysbiotic, or maybe there's just one particular type of bacteria that's becoming more prevalent, maybe it's more of an acid-producing bacteria, this is where we start to see issues that can lead to things like dental caries or cavities and periodontal disease and gingivitis. Another thing to note is even though we do want to address biofilm, break them open so that we can get to that root of the infection, we do want to proceed with caution. Besides bacteria in the biofilm, we may see other types of microbes, viruses, yeast, even pathogen parasites, as well as other toxins. There may be histamines present, there may be heavy metals, oxalates, really anything floating by. So it's kind of this delicate balance of getting through the biofilm layers to get to the root of the infection, but doing so in a way that doesn't create an influx of toxins, creating a burden on our body. And so we'll talk a little bit about this as we go through, but things using, support for the liver, using binders can all be really helpful to mop up those toxins and prevent them from causing more havoc. So here again is another picture of plaque growing, which is that visible biofilm. And again, that this is showing how teeth form, as well as implants and prosthetics are non-shedding, and this allows the biofilm to accumulate quickly. And so we need that regular removal of biofilm to help keep things in check and balances. The biofilm itself is not a problem, but once they start to become pathogenic or harmful is when we start to see issues. Now, I also mentioned something called lipopolysaccharides. Or LPS. These are very inflammatory metabolites that are coming from gram-negative bacteria. And the reason why we're talking about this is because this is a huge connection of why oral dysbiosis and oral pathogens play such a significant role in systemic disease from these LPS molecules or metabolites. Because we can easily transition these microbes from our oral cavity to our gut and into our bloodstream, the other thing that we start to see is the metabolites, both cytokines, inflammatory markers, our immune cells, and LPS can also translocate to different areas in the body. And these create extremely inflammatory responses. So that gets us into looking a little bit more closely on the systemic effects of oral dysbiosis. Okay, so I mentioned a little bit earlier, or just before, how we can have translocation. So the bloodstream is adjacent to these periodontal pockets. When we start to have inflammation in the gums, that can easily start to see a movement of microbes from the periodontal pockets into the bloodstream. In fact, the gums linings themselves are only a single cell layer thick. So this creates a very easy way that these microbes and their metabolites, like the LPS, can get into our bloodstream. And from there, they can travel to places like the brain, the heart, the lungs, and so forth, places we definitely don't want these bugs. The other way is through translocation of swallowing, right? So every time we swallow, we talked about all the bacteria in each liter and milliliter of saliva can get into the gut and then create imbalances there. One other thing to point out, one of the reasons why these microbes create such potent effects systemically is because once they pass from the mouth into the bloodstream, they can go directly to these vital organs. Whereas in the gut, we have the mucus layer that creates a barrier. And even if we do have leaky gut where these microbes and their metabolites escape into the bloodstream, the first place they go is to the liver through the portal circulation. And we know the liver is responsible for first pass clearance. It's helping to support breaking down toxins to safely excrete them from the body. So we have that extra layer of protection when we have leaky gut versus leaky mouth. With leaky mouth, leaky gums, it goes straight to these vital organs. So is everyone with me so far? I know we went over a lot, some things that may be review, but other things that can be really kind of, light bulbs turning on. Anything to add, Dr. Bauman?
Well, we've got more leakies now because
More
we had leaky
leakies.
gut, and that's, something we're familiar with. And now leaky brain is very common because of the barriers and the blood-brain barriers. But
Yeah,
to see the mouth as this in total universe, and almost the first universe of interaction with the environment. And there's so
exactly.
much of the environment in our mouth, and then there's so much, the biome is not the stomach. It starts with the mouth and the sinuses and all that. It's just mind-boggling. And then, of course, medication and chemicals make everything a mess. So
Exactly.
if we lived in a clean, simple universe with clean, simple food and la-di-da, everything'd be great, but it's not. And I'm thinking now of the children, in particular formula, and how
Oh, yeah.
is conventional formula is just such a, a terrible food, and sets up so much dysbiosis of the mouth, and young infection is such a prevalent thing. And the kid turns 1 and they get teeth pain, and your kid probably had a little bit of that. I'd be curious to hear that story, because
Yeah.
for some children it becomes life-changing, and then yeast
Oh, yeah.
sets in. Thrush can set in from early onset and hardly ever resolve. So,
Oh, yeah.
you know,
Yeah, you make a great point. I mean,
Uh-huh.
when we're really young and we're more vulnerable, and all the exposures, even, from growing inside our moms, and the exposure to, like, what was mom's oral health like,
that's right.
because that really sets the stage. And then, the formula and all the exposures, it can absolutely be deep rooted. And so it's really important to kind of understand that history so we can know how much to implement to support people getting their oral microbiome back on track, and therefore the rest of their health. Yeah, awesome.
Come back to that.
All right. Yeah. So this is
Yes.
just another picture talking about those mechanisms of transfer. We talked about it being easily transferred, the microbes easily transferred just directly into the bloodstream, into the gut. What's really interesting too is that in the gut lining, we have something called the enteric nervous system, which is really a huge component of that gut-brain connection. In fact, there's more communication from the gut to the brain than the other way around. And so this is another route in which these microbes can get to the brain through the gut, swallowing, into the enteric nervous system, and then up through the brain. And so we're going to talk a lot about, brain health, neurodegenerative diseases, because there is such correlation now between these oral dysbiosis and oral pathogens, and things like Alzheimer's disease and dementia and Parkinson's. So again, another place where we can really make changes for the better for our patients, for looking to the future, especially if people have family history of these things. All right, so whole body health begins in the mouth. I think by now this really kind of is making sense. But I always like to look back to what is the research showing, to really get a better sense of, how much this is implicating. So, when oral dysbiosis occurs, pathogenic bacteria reach levels that can lead to infections, such as tooth decay and gum disease, and ultimately a predisposition to many systemic diseases and conditions. So research has shown that more than 120 diseases originate in the mouth. Absolutely incredible. So here's kind of a list of some of the categories. And on the next slide, I'll just show you. I won't read through all of these, but I mean, connections, as I mentioned before, cognitive decline, huge connections between oral health and Alzheimer's disease, neurological health as well, things like anxiety, depression, insomnia, brain fog, poor concentration. I mean, a lot of times we don't think about treating the mouth to support these things, but they can make huge differences. GI discomfort, I think that makes a little bit more sense. We know that the mouth is connected specifically, that organ, that hollow tube connects directly to the gut. So that makes sense to treat the oral cavity to support things like gas and bloating and reflux and abdominal pain. I still think it's something that's not done enough or not thought about, at the forefront. You may be doing all the things that you can do for gut, healthy diet and treating dysbiosis. And if you're still not seeing improvements, then definitely think about the oral cavity. Blood sugar dysregulation, we'll talk about that in a little bit more detail, but there's a huge bidirectional component with things like diabetes and dysbiosis in the oral cavity. Cardiovascular disease. So as I mentioned earlier, they have found that arterial plaques in the inner lining of the heart chambers and valves have oral bacteria. And people with periodontal disease are 25% more likely to develop cardiovascular disease. I mean, that's huge. It's one of the leading causes of death in our country. Autoimmune disease. So again, that high amounts of inflammation that comes from the oral bacteria and the LPS can cause immune dysregulation. They've seen specific connections with rheumatoid arthritis and specific bacteria in the mouth. Respiratory health, mouth breathers especially, or people that are bacteria in the mouth can be respired into the lungs and cause pulmonary dysbiosis and other issues. And even things like weight management, right? So how oral dysbiosis and inflammation and cavities can affect our metabolism, also our blood glucose levels as well. Okay, so one more picture here that kind of shows all those connections. I just think it's so interesting to really hone in on how connected they are. There's a few other specifics here. So inflammatory bowel disease, which is an autoimmune condition. We talked about respiratory tract infections, meningitis, right? That affects the nervous system and the brain. Appendicitis. We talked about obesity already, but different cancers can be highly related. And even things like abscesses and adverse pregnancy outcomes. So here we're going to talk a little bit about some of the notable bugs in the mouth and why it may be good to look for these things and make sure they're in the right balance. So although there's hundreds of microorganisms in the mouth, research has specifically shown that there's several different pathogens that can really result in development of periodontal disease that's associated with some of these systemic illnesses. So I had mentioned before Porphyromonas gingivalis. And again, these are gram-negative bacteria, the first three, which means they produce high amounts of LPS, leading to high amounts of inflammation. So Porphyromonas gingivalis, such a tough one to say, is highly researched. We're going to show another slide just on that alone, but here are some of the associated illnesses: periodontal disease, of course, endothelial dysfunction, so of the lining of the vessels, Alzheimer's disease, irritable bowel disease, insulin resistance, even things like colorectal cancer and pneumonia. Treponema denticola plays a big role in periodontal disease. We've got Aggregatabacter. I'm not going to say that second part, but this particular bacteria has a huge connection with rheumatoid arthritis, which I mentioned before. And then there's some gram-positive bacteria, specifically Streptococcus mutans, which has been associated with things like dental caries or cavities, and even yeast like Candida albicans. These don't necessarily cause dental caries, but they can make the plaque formation more quickly and lead to more severe caries. And Porphyromonas gingivalis, again, huge connections here with multiple different types of illnesses throughout the body. It is a keystone pathogen for periodontal disease, and it's been associated with cardiovascular, metabolic, pulmonary, rheumatologic diseases, as well as cancer and poor birth outcomes. But notably, it's been implicated as a causative factor for Alzheimer's disease. So toxic proteases called gingipins cleave proteins in the brain, and they contribute to amyloid plaques that are the hallmark of the neurodegenerative disease. Okay, so a little bit more on oral dysbiosis and cardiovascular disease. So people with untreated tooth infections are 2.7 times more likely to have cardiovascular problems, such as coronary artery disease, than patients who have had treatment of the dental infection. So really important, if there's something going on, get it looked at, get it treated, get it cleaned. The other thing I think is really interesting is less than a minute after oral procedures, organisms from the infected site may have reached vital organs like the heart, lungs, and peripheral blood capillary system. So huge connections between oral cavity and cardiovascular disease.
Emily, I have a little question.
Sure.
Is there a saliva test that can indicate bacterial composition that's
Excellent question.
accessible and affordable?
Yeah, excellent question. Yes, there are, and there's a lot more coming out on the market. It's something I do have a slide on, just very briefly on it, but yes, there's a few that I know of. Bristol Health is one. what is it called? Direct diagnostics is another one. There's one that's called oral DNA. So yeah, they're basically like these oral swabs, and they look at your oral microbiome composition just like they would is like with a stool test, looking at your gut microbiome. That can tell you a little bit about, the balance between the beneficials and if you have the presence of some of these pathogenic ones. Yes, great
Okay,
question.
cool.
Yep, yep. In fact, it's, especially if you already have oral issues or periodontal disease, it could be a really helpful test to do, especially if you are adding in therapeutic treatments, to see how those therapeutic treatments are working. Okay. So this was a interesting study. This was done in 1985 in Sweden, looking over a 30-year period and following patients that were aged 30 to 40 years old. And what was interesting is that it followed them over time, and they were looking at higher plaque index, which is a marker of poor oral hygiene. And it can also show you that you're more likely to develop autoimmune disease. And so the results showed that the subjects with that higher plaque index, which was the marker of poor oral hygiene, were more likely to develop autoimmune diseases in 30 years. So really cool to see just the longevity of, in the impact of these changes in plaque. Okay, so as I mentioned before, oral dysbiosis and diabetes have a bidirectional effect on each other. So diabetes is a major risk factor for periodontal disease. It can actually increase the risk factor by 2 to 3 times above people without diabetes. And the control of periodontitis has a pivotal effect on the control of blood sugar, which is also how periodontal disease can affect diabetes. The presence of LPS is a major reason why there are issues, right? That inflammation can lead to something called metabolic endotoxemia. So inflammation and toxic issues every time we eat, which can worsen glycemic control. These inflammation can affect insulin signaling pathways. So we kind of have this, gum disease in the mouth. It increases the likelihood of diabetes. And then the gum disease can lead to higher blood sugar levels, which makes it harder for your body to fight infection, including the gum disease itself. And again, another list of how oral dysbiosis and neuropsychiatric disorders, again, probably the most research is the Alzheimer's disease. You go on PubMed and type in oral dysbiosis and, dementia, and you'll see tons and tons of research, or oral dysbiosis and Alzheimer's. You'll see quite a bit of information about, those connections. Now, this was an interesting study. This was looking at the oral gut connection. And those who brushed their teeth after meals were shown to have less Candida albicans, which is a yeast, in their stool. Like direct connection between the mouth and the gut. So this could be a very easy implication, sorry, my brain's a little slow today. It could be an easy thing to implicate to help lower yeast levels. Just brush your teeth after meals. I think a lot of us brush twice a day, but maybe you need that extra brushing after lunch. All right, so let's talk a little bit about the power of botanicals and how they play a role in supporting the oral microbiome. So I've probably shown this slide before, but I think it's just so important that plants really offer this synergistic effect. They have multiple different activities that when layered together can really create a powerful synergistic formula. They have antimicrobial activities. They have activity against biofilm, which we know especially for the mouth is really important. They have protective antioxidant actions. They're immune modulatory. And when you put them together, the outcome is not additive, but it's exponential. These botanicals offer a way to not only support the body, but to maintain balance, the power to thrive. So very important here, balance is the key. So Biocidin, as we mentioned earlier, is the company that I work for, and it is a formula of 18 different herbs and essential oils. And what's great about this formula is that it has many different mechanisms of action. They can simultaneously address different harmful bacteria, yeast, parasites, and even viruses. It also has very good action against biofilm. These herbs together are immune modulatory and also help to control inflammation. So it's a really great formula to have in your toolkit. We have different forms of it. depending upon where the infection may be. So different deliveries. There's an oral, there's a liquid that's great for the gut, as well as the capsules. There's a liposomal version, that LSF, which can be a little bit more systemic delivered. You pump it under the tongue. We also have a whole oral line, which we'll go over shortly. All right, so healing oral dysbiosis. So effective treatment requires restoration of a healthy microbiome, which includes antimicrobial activity against pathogenic species. So we want to get rid of the ones that shouldn't be there. We want to support the probiotic abundance of the beneficial ones that should be there. And we want to manage those biofilm. Now, botanicals are such a great tool because they don't wipe out all the beneficials. They really can target that overgrowth, that opportunistic type of infection or bacteria that can help to support that balance. So while biofilm are resistant to host immune responses and difficult to eradicate with antibiotics, botanicals also offer a really effective way to address biofilm. So here's a list of some of the herbs in biocidin, as well as a few of our other products that have been shown in research to go after biofilm. So a pretty good list there. And this product is very good at going after biofilm. All right, so disrupting oral biofilm is the first step in healing oral dysbiosis. Other considerations include seeding with oral probiotics to shift the host terrain. We want to rule out things like mouth breathing and continue to focus on things like diet. So break open the biofilm, support the balance, reseed with beneficials, and then work on the lifestyle things that are going to potentially lead to that out of balance state again. So achieving this delicate balance in the oral microbiome, it's essential to achieving optimal systemic health. And we can really make a difference for yourself, for patients, by doing things like including oral examinations. In fact, there are new technology coming out where you can do self-exams, something called GRIN, that you can actually attach to the camera on your phone, and it goes in your mouth. So you can actually take pictures and kind of review and evaluate what's going on in your mouth. You can send it to a dentist, or you can keep track of changes yourself. So that's really exciting. We're starting to work with them in some pilot studies. There's oral microbiome testing. So Dr. Bauman, you were asking about that. So actually getting a sense of which microbes are present in your mouth. Are they in the right balance? Do you have some that are more harmful that should be addressed? We can provide simple nutritional recommendations, and we can offer dentoceutical solutions. That's our herbal blend that we'll talk about shortly. So first, eating right for your mouth. There's many other recommendations, but these are just some key things that we can talk about when it comes to diet and oral microbiome health. So a diet that is high in proper minerals, think things like calcium, magnesium, and zinc. This is going to help inhibit tooth plaque buildup and help to keep your mouth feeling fresh and clean. But minerals are also helpful for that mineralization of your teeth, keeping them strong. Some mineral-rich foods include things like nuts, seeds, cruciferous veggies, eggs, avocados, berries, leafy greens, tropical fruits, and so forth. The presence of fat-soluble vitamins, A, E, D, and K, that can help maintain tooth structure and prevent decay. We have a handful of food sources here. So vitamin A can be found in things like eggs and oily fish, carrots, sweet potatoes, red peppers, mangoes, and apricots. Sources of vitamin D, I won't read through all of them, but if you want a quick reference here of how you can get those fat-soluble vitamins through your diet, really important to make sure those are present. And then foods that are high in antioxidants, that is going to help support gum health, to help protect from bacterial infections, and also reduce inflammation. So we do have some pilot studies looking at oral health. In fact, there's one that's happening right now. But this was a pilot study done by Dr. Rothschild, who's a dentist. He was looking at the fluids, the gingival fluids of 9 participants, and he saw that these participants had high levels of pathogenic microorganisms like gram-negative rods and spirochetes in their gums. He gave them biocidin LSF, which is that liposomal biocidin, to use as a rinse in their mouth. He was hoping that it would go after the pathogenic microbes as well as the biofilm. And he saw that 7 out of the 9 participants had a significant reduction or elimination of those pathogens just in 1 month of using the LSF. This was really exciting to see. This is one of the first pilot studies that we had that was specific to the oral cavity. And from here, we developed some of our own oral lines. We have a toothpaste, we have an oral rinse, and we now have an oral probiotic. Now, I don't know if this is going to work. This is a video. Let's see if you guys can see it.
Give it a try.
Let's try it. You may not be able to hear it, but this is another dentist. Dr. Can you hear it or no? I don't think so. I'm gonna narrate it. This is a plaque sample with lots of spirochetes, heavy bleeding, and other bacteria. Obviously, a lot of activity here. So what she did, she put it on a slide, and she split the slide in two. And on the other side of the slide, she adds dentalcidin, which is our toothpaste, and our oral rinse, onto the other half of the slide. And we'll see, she'll slide over and see what happens when she adds the dentalcidin to it. So here's the next cover slip. This is the one that she added the dentalcidin to. And you can see that it killed all the bad bacteria. Very effective at doing that. So really cool to see that in real time. And this is kind of what she wants to see when she's using a antimicrobial, to address these bad bacteria in the mouth.
Cool.
Yeah.
Is there a link for that? If we want to,
I can give you a link to that, no problem. Yeah.
Later on, send it to me or put it in the chat. Both.
Yeah.
Cool.
Okay. Go back to our slides. Perfect. Okay. So let's get into the dental-ceutical solutions, right? So we have 3 different products. This is our 2-step dental-ceutical solutions. We have a dentalcidin toothpaste, which has the biocidin formula, the 18 different herbs and essential oils in the toothpaste, and our dentalcidin LS. So the toothpaste, let's see if I have a slide. No. The toothpaste has 20% biocidin per tube. It's in a non-abrasive dental silica as a base. It's gluten-free, sugar-free, and fluoride-free. And it has a clove spearmint flavor. So just like any other toothpaste, you're going to brush your teeth twice a day with it. But what's really great about this toothpaste is that it's so much more than just a toothpaste. It also has that biofilm busting ability and that ability to address any dysbiosis in the oral cavity. So on top of the toothpaste, we also have the dentalcidin LS. This is a liposomal form of biocidin with additional CoQ10, quercetin, clovin, myrrh. So the idea with this one is that after you brush your teeth, 2 to 3 pumps in your mouth and you swish. Swish for about 2 minutes and then spit, kind of like an oil pulling. This is going to get to more deep-rooted infections in the gums, really help to soothe and reduce gingivitis and inflammation in the gums. The two together work very well. You can use them as standalones, but they do work best together. And we see the best results in about 4 to 8 weeks of use. And then oftentimes people will kind of use them as maintenance. Maybe they're just using them once a day versus all the time or a few times a week, just to kind of maintain and kind of keep that biofilm under wraps. I've noticed for myself when using them consistently, much less plaque buildup. Again, I mentioned that my son is 14 months. So, I still was coming out of that pregnancy, postpartum, where the oral cavity and the gums are kind of healing again. And I was getting quite a bit of plaque buildup, more so than usual. And this has drastically helped to keep that in check. So really exciting there. Now, probiotics, we talk about probiotics for the gut all the time, but probiotics can also really help support the oral microbiome. But we do want the specific probiotics for the mouth versus probiotics for the gut. So first, there are prebiotics, right, that feed the good bacteria, and that can come from things like fiber. So making sure that you eat a variety of different fruits and veggies, eat the rainbow is really important, because the strong presence of these healthy bacteria help to keep out that opportunistic bacteria. They help to keep them in check so that some don't just become overabundant. So there are oral probiotics like lozenges or chewable tablets, or mouth rinses, drinks that can allow the bacteria to stay present in the mouth. And here's a list of some of the good bacteria to consider that we know really help support a healthy microbiome. So again, I won't read through all of them, but here's a handful of those microbes to think about that are beneficial to the oral microbiome. And so we have our newest product actually called Dental Flora. So this is a oral probiotic. It is a tablet that you let dissolve in your mouth. It promotes healthy teeth and gums, supports periodontal health. It does have some xylitol that not only slightly sweetens it, but xylitol has also been studied to reduce tooth decay. and it also has a spearmint flavor. So kind of like a nice mint that you can take before bedtime, typically right before bed. You'd put it in your mouth after you've brushed your teeth and used your dental sign LS oral rinse. You let it dissolve, and then ideally you don't eat or drink anything for at least 30 minutes. But if you're taking it before bed, then that's easy to do, allows those microbes to settle into the mouth. It has 4 targeted research-backed probiotics. The most highly kind of the major one that we really talk about is the Bliss M18. This is lots of research showing its effects against fighting plaque and supporting dental caries, beneficial for good breath and so forth. We also have a scientific advisory board that works for us, and one of those is Dr. Ariana Ibrahimian. She's a biological dentist, and she actually helped us formulate this product. So it's really nice because it is dentist formulated. It includes 5 billion CFUs at manufacturing, but we do only have 3 billion CFUs on the bottle because at 18-month expiration, that's how much is supported to have. And it's really easy to take, like I said, just one at bedtime, and it doesn't have to be refrigerated.
So question, is it in a cap or do you take it out of
It's
the
a tablet. Nope,
So
it's a little tablet
Do you
that
suck
kind of like
on it?
that you suck on it and you let it dissolve in your mouth.
Good.
Yep.
Good.
Yep. It does take a little bit of time to dissolve. So some people towards the end will kind of, crunch, chew a little bit. Yep. But as long as you can keep it in your mouth, the longer, then it has the ability to, get those probiotics in the oral cavity. Yep. So lots of different ways to go about, the different steps. You could just brush your teeth and use the oral probiotic. Some people may want to add that extra rinse step with the dental sign LS to support even further deeper in the gums. So who is this for? This can be really for anyone, especially we talked about all the connections to systemic health and, chronic disease, chronic illness. So this could just be prevention, but it could also be for those at risk for dental caries and tooth decay, at risk for periodontal issues, anyone with existing periodontal issues, or just individuals looking to optimize their oral microbiome. So my last slide here, and we'll get to some questions and discussion. So hopefully you really learned a lot, but here are some takeaways to remember. The oral microbiome is the second largest microbiome in the body after the gut. Our teeth are the only natural non-shedding surface where biofilm can easily be manufactured. Biofilm are inevitable in the oral cavity and are typically benign unless they become dysbiotic, leading to more plaque buildup with higher acidic environments that can cause damage to the teeth and gums. Periodontal disease, which includes gingivitis and periodontitis, is the most common inflammatory disease globally. Oral dysbiosis has drastic systemic effects due to the ease in which dysbiotic microbes and metabolites can enter the bloodstream, translocate to the gut, and lack that first pass clearance by the liver. And interventions, including proper diet, lifestyle, and botanicals, offer a therapeutic strategy to address plaque biofilm, support microbiome balance, reduce inflammation, and support beneficial oral flora. So a little bit, if you do decide you want a pro account, I can put this link in the chat too, but we have tons and tons of education and resources on our website through this Bioscience Academy. It is aimed for, practitioners to really help them help their patients better, but we do also have a consumer version of this called our Health Hub. So even if you're not a practitioner, you just want to learn for yourself, you can go into our website and see the Health Hub and get tons of access to, articles and blogs and webinars as well. So I'll put this link in the chat for you guys in case anyone is interested in creating an account. All right. And then finally, as a little thank you for joining, we are giving 15% off until the end of March here. And that's the code that you can use. Again, I'll copy that into the chat, but it's 24BW.
For consumers or both?
It should be for both.
Okay.
If anyone has any issues, you can just let me know and I can help you out.
Got it.
Yep.
Cool.
All right. Well, thank you so much. I hope you guys learned a lot. Maybe again, some review, but yeah.
If you want to go back to the group deal, we can see everybody.
Absolutely. Let's do it. Okay. So let me pull
That
up the
was really
questions
good.
here.
Um,
All right.
so one question is about brushing your teeth after the meal or waiting a half hour after the meal. One of our guests said, I was just advised to wait a little bit. Is there a comment on that?
Yeah, great question. I've actually had a few, I've done this presentation before, and I had someone else also ask me that question. I have heard that there are maybe certain foods like fruits, that you do want to wait a little bit longer so that so you allow kind of those nutrients to absorb. Um, so I would say, yeah, I think waiting at least like a half an hour would be a great option so that you can allow any nutrients from the food to do its thing and enzymes. But
That's
then
true.
you're not,
True.
yeah, but
Yeah.
then you're not letting, little tidbits of food linger that can then become, issues for leading to dysbiosis. So I think leaving a half an hour is a great option. Yep. Yep. Great question
Other
too.
one was a question about would sleep apnea aggravate the oral biome?
Yes. You're
So,
talking about just in general having sleep apnea?
well, or someone who has sleep apnea and they have the machine and their mouth's open,
Yeah, so
all
these
that.
are great questions. So sleep apnea itself can aggravate the oral microbiome because if you are a mouth breather, that can really dry out the mouth, right? And we talked about how saliva, it plays a really crucial part in supporting the pH balance of the mouth. It has immunoglobulins, it has enzymes that help to control the microbes from overgrowing. So um, definitely, I would say getting on a CPAP machine would be really helpful to prevent that those issues. Obviously, being on a PAP machine can still potentially have a little bit of drying of the oral cavity. The other thing to think about with a CPAP machine is that it also can accumulate biofilm on it. So making sure that you are staying on top of cleaning your CPAP machine is really important. Even you could use some dental side-in and kind of brush it and rinse it with it. The other thing too that comes to mind is just like I have a mouth guard that I don't always use, but at night for teeth grinding. Well, those mouth guards can just as easily form biofilm. So when I do wear it, I do try to, brush it with dental side-in anytime I use it and then dry it really thoroughly so it doesn't have that opportunity to build up bacteria. Yep. Okay,
I'll say
what
I've
other
used the
questions?
toothpaste and the spray, and it's really great. I mean, it's
Yeah.
so botanical. When you have a clove or you have a garlic or you have a golden seal, after a while, you just begin to love the complex feeling of plants in your mouth
Oh
versus
yeah.
sort of sweet saccharine toothpaste that
Yeah.
really is not of much value at all.
Yeah,
Um,
we've had some comments in the past. Oh, like the color of our toothpaste is this deep brown,
it
almost
is,
magenta,
yeah, that's
because
great.
that's the color of the herbs, right?
The
So where
plants,
people are used to seeing this white bleached,
that's good.
toothpaste. So yeah, I think going back to your point, I mean, once you start using it, it's just you notice that your teeth feel less fuzzy in the morning, you don't have that coating on your tongue. Like I said, for me, I really noticed that the plaque buildup behind, the bottom two teeth is way diminished. Yeah, they work really well. I know I saw a question here about flossing. I didn't specifically talk about that, but in the category of oral hygiene, yes, very important. This is again something I need to remind myself to do more. But it's very easy for those microbes to manufacture and hold on in between the teeth where we're not getting with just a toothbrush itself. So anything you can do to mechanically remove these biofilm is going to be really key. Um, Especially if you have tight teeth or areas where there's pockets build up in your gum tissue. Water picks can be another option
Yeah,
to get to those tight spaces and make sure you're cleaning things out really well. So
you could put some of this biocidin in a water pick would be fabulous.
yes, exactly. Yep,
Yeah,
we have a
very
lot of
good.
people do that.
Yeah.
Yep.
There's a question about cider vinegar and brushing and such. How could that be utilized?
Yeah, I mean, I know I use apple cider vinegar a lot to help address things like yeast overgrowth in the
Yeah,
gut and to support enzyme production. So if you are dealing with maybe some yeast, like oral thrush or something, you could kind of swish with apple cider vinegar, and that could be helpful. And then, yeah, you'd want to, wait to brush your teeth, so you can let the apple cider vinegar do its thing. Yeah. All right. Is the toothpaste glycerin free? Yes, I believe it is. Let me check on. That's a great question. While we have other questions, I'll take a quick peek at that. I know what I will tell you is that the owner is very passionate about her animals as well. So we had switched, we don't use, I believe it's not xylitol or one of the sugars that animals don't do well with. I believe it's sorbitol, because you can, although it's off label use, but you can use it on, horses and dogs and so forth. So there's a specific reason why there's that a specific sweetener. And I think it's sorbitol actually, but I'm going to look it up for you while we're chatting.
I think so too.
Yeah. But yeah, I don't think there's I will say the only thing is glycerin is in biocidin itself. It's part of the proprietary blend, which is what makes it a little bit sweet. But it's, directly from plants. So there may be a little bit of glycerin just because there's biocidin in the dental sidin. Yeah. What other
question? The glycerin, could you share what's the adverse reaction you get? I've not heard about glycerin sensitivity. You could put it in the chat or just verbally share it.
Yeah, so sorbitol is the main sweetener ingredient of our dental sidin toothpaste.
Okay.
But again, as mentioned, yeah, there is some vegetable glycerin because that's a component of biocidin itself. So yeah, I'd be curious too. I mean, everyone's, has their own sensitivities, but
it's a large molecule that doesn't absorb. So that's why it's typically well tolerated. Doesn't affect particularly.
Right.
Doesn't affect microbial growth particularly.
Right.
Yeah.
Yep.
And I suppose somebody could
and
try
I will say
their own, but it's it's a little complicated, and the company has put together a very kind of well-balanced, user-friendly product. So
and
whenever I go to the dentist, I always make deep commitments to improve my oral health, and then it slides.
Same here.
And it slides.
I know, that's the problem. Well, so I will say, that's where these products come in handy so much because you're going to brush your teeth every day anyway. Hopefully, a few times a day. I mean, I will say I'm not the best at flossing, but keeping up with these has really helped to support that oral health in between cleanings, even if I'm not flossing as much as I'd like to. So
I have a curveball question for you.
Sure.
What about chronic sinus infections?
Yeah, great question.
Just think about it. It's part of this cavity. It's part, what's in your mouth is going to affect what's in your sinus. And it's very common for sinus infections to be quite aggravating. And then people, they try antibiotics and then they get yeast and who knows what happens.
So I would suggest if you do have, that chronic reoccurring sinusitis, that you do treat the oral cavity alongside treating the sinuses. And this is a great example of where our products work really well when you use them in conjunction with each other. It's all about delivery, right? You want to treat the infection locally where it's at. So you may be using dental sidin for your mouth, but you can also use the liquid biocidin in a nasal spray, in a nebulizer, or even in a neti pot.
There you go.
Address it locally in the nose and the sinuses. So I would do them both together. Maybe you're also taking the liquid internally to address your gut, because we know every time we, the postnasal drip and in your mouth and we're swallowing, so it's affecting the gut as well. So you do want to use these products, in all the different locations that you may need them for the best results I've found.
Again, another support statement is I've used them on and off for 25 years.
Mm-hmm.
I don't use them all the time.
That's awesome.
But then again, having them is a great thing to have.
It is.
Using them when you start to get congested or whatever, you could tell things are not going so good. It's really good. And they're kind of balancing formulas.
They're very balancing.
They're not heavily aggressive formulas. When you look at, wow, how do you clean up some seriously deep problems? A lot of it is bioflavonoids. A lot of it is polyphenols. A lot of it are antioxidants. It's not just hardcore antimicrobials. And so I think, obviously medicine can get very hardcore, and then it can leave, adverse, side effects. But these types of diverse plants, which have diverse value across the body, it's not just a single organ or a single issue. It crosses all the barriers, really. And then it's sort of being smart in how often and how frequently you use them. And that's
Right.
just something you learn over time. Practitioner
Right.
can't always say, we'll do it 2 times a day or 3 times a day or 4 times a day, because if you're in an acute or subacute stage, you take it a little more. And then when you're
Right.
in a chronic, you take it a little less. And then when you're doing
Yeah.
good, maybe you don't take it. And then, as need. But it's really like having a good tincture or tea that you enjoy taking, because it's time for that herbal complex to come through.
Yes.
And that's a remarkable, I'm telling you, it's a gifted formula, whomever brought that one down.
Yeah.
It's really,
Yeah,
it's
I agree.
maintained its integrity for many years, which is kind of cool, because people are always adding the latest, greatest thing. And then it also pushes the cost up higher and higher. And these are not inexpensive, but they're not exorbitant either. And then, comparing it to toothpaste, you go, well, gee, my toothpaste cost me half as much. Well, your toothpaste was doing you no good, period.
Right. It's definitely not breaking down the
So
biofilm
these
like
things
the dental side is.
things are really taking good care of the oral biome, which is like the big, it's the beginning of the biome. It's upstream. If upstream is messed up, downstream is going to be much more messed up. So it's kind of brilliant to even be aware of this and start to give it its due respect.
Absolutely. Thank you. I appreciate that. And I agree. I feel like every home should have these products, whether it's to treat something acutely and have on hand, or a chronic condition, or just to do a regular kind of reset. We talked about that at our last talk. So yeah, awesome. And yes, Tina, absolutely. The flossing is not just about removing particles, but breaking up that biofilm between the teeth. I mean, anytime we can mechanically disrupt those biofilm, that's how we keep them in check. So absolutely.
Yeah, that's great.
Yeah. Any other questions from anyone? This is great discussion, at least on the chat. And sounds like, this has been helpful information, hopefully.
We'll share this video with folks, because that's always nice. We take the Zoom, put it into a YouTube, and then we send it out to people who registered, and some people couldn't make it, so they'll be able to see it. And actually, Bauman Wellness has a big YouTube station that very few people visit.
Yeah.
So,
well, that's great.
Take a look. I mean, it's just there. It's public access, and we have 2 previous talks by Dr. Emily and all kinds of good ones. So, and moving forward in April, May, and June, it's Food is Medicine for Mental Health. And I'll be doing the kickoff lecture. I believe it's April 10th, either 9th or 10th, something like that. It's a noon program. We'll do 2 a month, 2 Fridays a month. But I just can't thank Emily enough. You really go out of your way to get this organized, and it's just so clean and it's so
well, I'm happy to share
the
knowledge with all of you, and appreciate it.
Yeah,
someone's asking, so there are a few different kits and packages.
there are.
Yes, so all the packages are already 15% off all the time. You can't use an additional 15% off code for those packages, just so you know, the bundles. But yes, the package includes the toothpaste and the oral rinse.
And if people don't have an account, I can order and have it shipped to you, or you can order as a retail customer. Is that correct?
Yes, you can. Yep, absolutely.